going to have more and more people, I think, coming in during the session as people are re-signing up and getting the link. We had 568 people sign up. So that's a really large number that I'm really grateful for, and grateful for everybody here to be on. We have a lot of different types of individuals that are here. We have cancer patients, so I'd like for us in the chat to be cognizant and health literate and compassionate for people who are here also to find out information. We have a really great mix. We have individuals that are from the medical side, people that are from the complementary side, and really this is all about a discussion, right? I have found it fascinating speaking with some researchers that might say, well, why would people ever consider, alternative or complementary? And then I have people on the alternative side that would say, why would people consider conventional? And so I think it's a great conversation starter for us. We're definitely going to bring in some evidence. We're definitely going to bring in how integrative oncology works and how we work with clients in various capacities. So I think that that's really important. If we could mute everybody when they come in, that would be great. Thank you.
So Julie, before we jump in, let me quickly make the introductions and go over some logistics, okay? Good morning, good afternoon, good evening, everyone. I'm Jessie Brandt, Director of Programs and Operations for the Global Wellness Summit and Institute. Welcome to the Integrative Oncology and Cancer Self-Help webinar. Please introduce yourself in the chat and let us know where you're joining us from. Before we start, here are some quick logistics. Feel free to select speaker or gallery view. Please keep yourself muted when you're not speaking, and I will mute everyone shortly. And speakers, just remember, if you are want to talk, you need to unmute yourself too, because I'm muting everyone now. Please turn on your camera if you can. This webinar is being recorded, and we will share the recording along with the chat, important information, a slide deck, and a follow-up email to everyone who has registered. Please post your questions in the chat, but keep in mind we likely can't address all of them. It's now my pleasure to introduce Julie Bach, Chair of the Wellness for Cancer Initiative. Julie, good morning. Over to you. You're muted. Julie, you're muted.
Yeah, I see that. Thank you. Well, first of all, thank you so much for the Global Wellness Institute for hosting this. As I already stated, that some of you have just come on. We had 568 and counting people that registered. So this is a really beautiful topic, and it's a wonderful time to bring us all together to discuss, what we saw in the Netflix series, what we want people to know. And as a panel, we're going to share how we work with individuals navigating this journey between alternative and medical and integrative oncology. I do have a handout, and we won't start with the handout, but I do have one that will provide you with the definition of integrative oncology. Again, we do have patients and carers that are on the call. We have many researchers on the call, Ayurveda, from allied health professionals. So it's a great group. It's a great time for us to understand what the messages were and how we can be more clear, how we can support people navigating this, viewpoint of medical and complementary, and how they can fit together, or how some patients are working with their doctors and other service providers to just work on complementary or alternative. So I don't see our first speaker yet, Rosie. So we will jump over to Lainey first. Lainey, if you could introduce yourself, and then what did you hear from this Netflix series, Apple Cider Vinegar?
Hi, Julie. Hi, everyone. I'm excited to be here. My name is Lainey Francis. I am a medical oncologist and hematologist. I'm from Pittsburgh, Pennsylvania. I work at University of Pittsburgh Medical Center, UPMC, the Hillman Cancer Center. I'm a conventionally trained Western medical provider. I did medical school in the United States. I did a residency in internal medicine and I did a 3-year fellowship at the University of Pittsburgh in oncology and hematology. I have a practice that is a medical oncology practice and an integrative oncology practice. And I also am the founder and director of a center at UPMC and a program called the Wellness and Integrative Oncology Program, where I see patients with my team. We evaluate what they're looking for, and our focus is on symptom management and quality of life with a holistic approach. Often people are looking for less medicines, looking for lifestyle advice, and are seeking it out in the context of a conventional cancer program. And it's an interesting perspective in this setting to talk to all of you. And it was very interesting to me to watch apple cider vinegar, which I devoured because it hit so many points that I think about, that I question, that I wonder about. What I heard and saw was that a lot of different human beings were not feeling heard on all sides. And that was a very striking observation. I also felt something that I see in my practice, which is this sense of rush and urgency, which in many cases is very important. But I saw both sides responding to this kind of fast temporal pace in and around decision making, which I think is important. And then I also saw sort of the life of social media and influence and perception, as well as a large cost of resources. So I'll stop now, and I'm really glad to be here. Thank you.
Beautiful. Thank you. So Aga is a cancer nurse, a health coach, as well as the co-chair for British Society of Integrative Oncology. And so I'd love for you, I kind of gave you an introduction, but I'm sure there's more you could say. And what did you hear or see in the series?
Yes, thank you so much, Julie. And it's great to be here and being part of this wonderful community. So, yeah, as Julie mentioned, I am a clinical nurse specialist. I'm still working within a big cancer center in the UK, in Guildford. My role has evolved from being hands-on clinical nurse, like Lenny, conventionally trained. And then I've moved through my career having multiple hats on, and through my own experiences, I've moved into the more integrative approaches. And that was purely based on my experience of witnessing how a mainstream medicine reaches the point that beyond we can't offer anything. So we very often, it felt to me like we're disempowering patients. I've witnessed a lot of traumatic conversations and medical healthcare professionals' inability or lack of training around the good communication skills that led into, to people being left disempowered. So what Lenny was saying about the decision-making process, this is a big thing for me that kind of been highlighted in that series, and I would like to speak to that a little bit later. But yes, I'm a health coach and trauma therapist now, and I still work in the hospital, but with the hat on a cancer engagement lead when I work directly with the patients to influence the changes in the training around the mental and emotional and psychological support. So I am looking at the apple cider vinegar from a slightly different angle, while much of the discussion really focuses, and I have been in that space as well, on health and wellness and alternative holistic approaches. What really stood out for me was that the reminder that perpetrators of fraud and scams, they don't care about us, they care about themselves. And this series is a great example of how deception can be disguised as inspiration and how easily trust can be manipulated when we assume certain things. And that was my bias, and I got really highlighted to that. And the bias was cancer is off limit. And it isn't, right? And there is a lot of that. So for me, this series was a powerful reminder that the scammers do not have moral boundaries. And some may think no one would fake cancer, and that's unthinkable. But there we go. Real life case provides that it's not about illness, it's about them. And I really want that to land. And the scammers use whatever works to gain attention, trust, validation. And that is why more important than ever for us to be able to be and teach our patients and work with our patients about being vigilant, do our own research and rely on trusted sources and really kind of move away, take inspiration if we have to and if we feel like in the moment, but check it. You know, social media trends are a great place, but also a big danger. So it's more, this apple cider vinegar for me is more than a cautionary tale about alternative medicine. I want to move away from that. It's not about that. It's actually about the scammers, you know, who did that, who used vulnerability of people, and we are not off limits. So the cancer is not off limit for whatever we may believe. That's my take. Thank you.
I love that. And thank you for shifting that conversation for us. Let's move over to Jean. Jean runs the Patient Advocate Special Interest Group for SIO. A question is, yes, is this webinar being recorded and will it be available? Yes, it will. So Jean, as a cancer thriver yourself and working with many support groups around the world, I'd love to hear what you took away or what you heard in this series.
Yeah, good morning, everyone. I watched, of course, through the lens of a survivor, and what I found was nobody directed the patients to another patient, to a buddy, to an organization that had other information. And so it really felt to me like that lack of information of just to get a buddy. It was the very first thing I wanted to do in 2003 was to find another woman that had colon cancer. So that piece, and then not knowing how to present what research based to a patient, you know, to talk about why a doctor would say this. And so the patients were like, you want to take off my arm. And without, you know, really talking about research, and we have to be a little bit research literate even as survivors. So, and then the message of these things are going to cure you without them asking, how do you know that? And so it was like an N of one. One person had a certain amount of success. That doesn't translate very well to a population. So that's what I was looking at.
Beautiful. And I haven't seen Rosie come on yet, so I will share what I saw and heard. And maybe Susie Ellis, who actually inspired me by her post on LinkedIn. And I saw all these people responding to how they viewed the series. And then I saw all of the cancer chat boards, you know, just buzzing about this. So for me, I have not seen it so black and white where patients don't feel heard. And so I think that that's one of the things that I saw, that maybe it still happens, maybe it doesn't. The role of evidence is extremely important, and Aga brought this up. And, you know, as the wellness industry starts moving more into integrative, you know, again, it's the same thing. We have our own influencers. We have people who speak, and what are their credentials, and how deep are they in the field, or are they listening to a presentation and parroting back what they heard? And so we also have to take a look back at, you know, what is our role in influence? Now, I will say that I do follow about 18 influencers in the cancer space on Instagram. And I do appreciate the passion that people have from their own journey. And this passion to want to share is actually what helps transform people and helps transform that healing journey. But there is a limit to your data point of one, right? Like Jean had just said. And so we also have to be, aware. Though I do see on social media that I really like, and I'm trying to digest this, and this is one of my challenges to everybody, is how open and easy things seem to be versus, oh, you need to exercise 150 minutes a day and you need to do this and you have to do this. And when we talk from a clinical guidelines versus health literate and opening, I can see why people watch and listen to people on Instagram, because it seems a little easier to do, right? Especially when you're in this fear place. So I want to move to the second question. We'll start with you again, Lainey, of, how do you navigate this specifically, if you could give us a client example of how you navigate it either way, what your clients are speaking to you and how integrative oncology supports them and how you as a hematologist oncologist supports them.
Well, I would say that we get people coming to us with a lot of different goals and needs. Um, a lot of people don't even really know what we are, or their doctor will get a sense that they want something more and sort of send them our way, or people find us. Um, there are people with a really focused interest in symptom management, who either want to be proactive about symptom management and take less medicines, or are having a symptom that has not been helped with medicines and are sort of like, I'll try anything. So that's a common population: patients with neuropathy, nausea, pain, anxiety, that sort of either don't want to take more medicines or have tried things and want, or sort of, I'll try anything. So we see patients with chemotherapy-induced nausea, neuropathy. We see patients that are overwhelmed, fatigued, and we do a lot of acupuncture in those. We recommend a lot of acupuncture patients to acupuncture, yoga, exercise, nutrition. We are set up to be helpers and implementers, and that was something very important to me in starting the program. Was exactly what you were saying, Julie. It's so overwhelming. It's so hard. It's perhaps behaviors that you're leaning on for comfort, such as eating or not moving or resting. So there's so much coming at you when you have cancer. So we wanted to really try to embrace people, make them feel heard, address their symptoms, and hand them over to someone who could do the thing in our space, not a separate trip. They're there, they have these concerns, and they are able to either that day or shortly thereafter meet with our acupuncturist, try a session, see if it helps. So over the years, we've tweaked and retooled so that we are able to really embrace people and help them in that moment. So again, the symptom management is very common. Patients that want to be prehabbing themselves. They're having a big cancer surgery. They're about to start chemotherapy. They want to try to understand a more comprehensive planning in and around how to do that. A lot of patients that, um, you know, don't feel heard, because I do see that a lot, honestly, and kind of need a second voice to help integrate. And this is sort of another definition that I think is really important as an integrative oncologist in the medical space, is integrating people's needs and questions into conventional medicine or vice versa. So really listening to people that either want to slow down the pace, want to do more baseline testing to understand where they are, want to do things one at a time. And this is not necessarily always an evidence-driven or research-driven situation. Often this is an N of one, which I'll only push back on sort of some of the things I'm hearing, because a lot of people say, this is my body. And I heard that in apple cider vinegar. So I hear your research, I hear your studies, but this is my body, and maybe it will be different, or maybe I want different things. So I think when we think about value-based care and we think of patient-centered care, for me, I really am intrigued and interested in hearing people's stories and hearing their values, um, trying to back up and understand if they understand these terms like cure, like adjuvant therapy, which means therapy in addition to something like surgery when we're doing that to decrease the risk of recurrence. So finding these terms, finding patients' values, um, really scaling back with them. To me, that's an integrative oncology consultation and advice driven service that I'm providing that goes beyond the things like the acupuncture and the lifestyle. So I'll stop now.
Beautiful. So, Aga, as a health coach, maybe you can also share how you're working with individuals. And thank you, Lainey, for bringing up the health values, because that is an important part of the discussion, as I'm sure Aga will touch upon.
I love that. Actually, I'm going to say all this what Lenny said in my practice, and so I am in the really privileged position because I spent 25 years being an expert in the conventional medicine, being the person that people turns into. So I've been clinical nurse specialist, specializing in in the research, cancer research for upper GI cancer, and then I moved into cancer of unknown primary. And what I found was that it was such a comfortable position if you were just framed in that guidelines that you have, and we on NHS very strict on that. We can't go beyond and above. But I've burned out. I've burned out because I felt like we do not, we can't empower patients beyond that because we were putting a stop. And even though my own belief, so I'm very open to supportive medicine, alternative medicine, and holistic approach, because that was my journey to self-discovery through my burnout that I was experiencing as a healthcare professional. Therefore, I knew the access to it, and I couldn't convey that to patients because I was restricted. So when I then moved out from that space and trained as a health coach, I was able to practice in my hospital within that but within the holistic center support. So it was really interesting space. So I was, in some of the days, I was still working in the hospital as a nurse, and some of the days I was working as a health coach in completely different ways of working, which is really, really interesting. So for me, my perspective of decision making in healthcare, when we take that integrative aspect of it, is not just about presenting options. So I specialize now in trauma therapy, and trauma especially in context of a cancer and other conditions. So there is a little bit more than just information giving that we are trained to do. It's about presenting options. It's about preparing the patient's mind to make the best informed decision. And I was lacking that in the series really badly. And it is about the state of clarity rather than the fear. So many patients I work with, they struggle with emotional burden of choosing between different treatment paths, and the plans, and especially when the stakes are so high, and they're hearing all this information from left, right, and center. So the stress and anxiety surrounding decisions can really activate the fight and flight response. And we know when you are in a fight and flight response, that have a significant impact of cognitive function. And I used to work in the space that was not taken into consideration. The information were given to a patient, and the patients were, they just couldn't take it on, couldn't hear. And then we as a nurses took all this conversation, all the phone calls. Oh, I didn't hear that. I didn't hear that. And the frustration between the patients and the healthcare professionals. So how didn't you not hear that? We just told you all this, that sort of things. So for me, it's about preparing patients for that, being really aware of that. And when a patient is in a heightened state, the ability to, again, weigh pros and cons, to go and do the research, process the information effectively is really compromised. It's not happening. And that really leads then to fear-driven decision rather than informed ones. And again, we've seen that the moment that they were talking about taking the arm off, she was completely into fight and flight response, like, well, what do you mean? You know, that sort of thing. So there was no reasoning, and there was not even opportunity to discuss that further. So to support patients through this process, I start from helping patients recognize and regulate the stress response, making sure that they calmer, more receptive state, to make the choices. And I train the doctors and nurses now to recognize that state and to down-regulate and co-regulate together. So beyond the stress, and you've mentioned that, Lenny, I think, you know, that resonates with me a lot as well, is the aspect of personal beliefs and past experiences. What is that person coming into a space of cancer center? What do they believe about cancer? Right? What do they believe about the treatment, the conventional treatment? Because they may be freaked out based on their past experience with their mums, their grandma, you know, going through the movies that we watch, you know, all the lost hair and things that we all put into the one basket. And that really makes an impact of how we take the information. And this is what you were saying, Jill, you know, what makes people want to go to conventional, take the treatment, take the chemotherapy, all that anti-cancer treatment, and what drives people away? Sometimes is the belief and is the fear-based. You know, all the stories that we share and the shared experience is really, really important. So, you know, I help patients explore origins of those beliefs and separate the past from the experience now, to build that capacity to hear all the stories, to hear all the advice, to read the research and make a choice based on knowledge, checked knowledge, research knowledge, rather than based on fear or based of being inspired by someone, right? So it's about really building that present reality, provide evidence-based information to ensure the decision is truly their own. So as a health coach, I really feel that having those health coaching conversations, even by our clinicians, is all about patients being equipped to make the right decision, right time for them. So when they challenge that years later, saying, oh, you know, you told me I should have been doing this or I shouldn't be doing that, you won't have that conversation. I have a client at the moment, I work with her for the last 3 years, and I've been through all this decision-making process with her. And at some point, she made a really important decision of moving away from a conventional approach of hormone therapy, following her anti-cancer treatment, to lifestyle medicine. But we've made sure that she is well equipped. She's not fear-driven decision, it's research-based decision. And then she had a scan not that long ago, and she said, Aga, oh my goodness, I don't think I made the right decision. So we could then go back and say, hold on a minute, how did you make this decision? And when we went through all this, you were calm, you researched everything, straight away, that anxiety just went. She said, okay, so whatever happens now, I know I've made the right decision then. So that's how I now support patients, and that's how I teach clinicians and nurses and doctors to really create the space that takes into consideration people's mental health, their beliefs, and their values. I hope that helps, Julie.
Oh, that's great. And before I come to Jean, I just want to piggyback just a little bit. If you can tell, I like to speak. As a health coach myself, it's very similar to Aga's approach, you know, helping people first to be able to access their executive function, right? Getting them out of fight or flight. You know, they're hit with so many messages from people, from friends, from people in the workplace. Did you hear this? Did you hear this? Did you try this? My uncle did this, right? They're researching on the web, but, you know, they're still in fight or flight. So for me as a health coach, that's the first thing I do is I breathe, whether it's heart math, whether it's I'm bringing in my yoga therapy background, you know, helping them first to calm down, right? And then exactly that, checking in and seeing where they are. What does that diagnosis mean to them? What are their health values? Really important point that most cancer patients are not asked, what are their values? And, you know, a lot of us think cancer is a certain way based on what we've seen other people. And what we tell a lot of people is cancer is not your grandma's, cancer. It's changed and so people don't know that. And because we're steeped in it, a lot of us, we might assume that they know that. So that's where the health literacy, really comes in. And we're going to open the floor up shortly because I know some people want to jump in on this conversation. What I see people also coming to me maybe have 3 different emotional responses. One is they collapse. Right. So now I'm working with them. I'm looking to see, do I need to refer them to a mental health professional? Maybe they just collapse. Other people, they ignore that they've had this diagnosis and they just continue on with life and don't want to touch it. I've had many people that are afraid, and we have to work through their fears and what is under those fears. And then you have those that really kind of try to normalize, for lack of a better, cancer into their daily life. And these are the people that have, and I wish Rosie were here because she has a lot of science on it, but they really are self-empowered. And that's really the job of a health coach, whether you're a health coach as a person or a health coach as a process. It's helping people know that, yes, maybe there's things that they can't control, but there's a lot of things that you can control. And it's helping people move from passive to actually owning their journey and how they can take steps with exercise, with nutrition, with mindfulness, with many different evidence-based practices that they do have control over. So that again is health coaching, and health coaching as a process that might be new to some of you. It may be things that you're already including within your conversations with your patients. Jean, let's come to you as a patient advocate, so I can be quiet.
As a patient advocate, I will get referrals from a friend of a friend or somebody that I have been a patient advocate for, and they'll have a friend who also gets a diagnosis. So there is somewhat of a connection usually, or they see me on Facebook and they say, I see you put a lot out there about cancer and I have this question. So to me, it's usually somebody who's very early in the process. Maybe they don't have a complete diagnosis. And my very first thing is I want them to get three opinions, and at least one, if not two, at a teaching hospital. And unfortunately, here in San Diego, we have that. So I'm thinking of one person who came to me. They're a little far out in San Diego County, and she was diagnosed with stage 3 colon cancer, and they wanted to take her entire bowel. I've been doing this for 20-something years, and I've never heard of that. So, and she was ready to do it. And because sometimes what I see is people think, the doctor said to do this, I'm going to do this. I can't handle anything else. I don't want to hear anybody else. So I'm just going to go. And so it took me a long time to just convince her that what I have learned as an advocate and what I have seen make a really big difference is getting a second opinion, maybe a third opinion. Well, her second opinion was at a teaching hospital, and they gave her 3 alternatives. And she felt heard. And so, she said to me, I'm so glad you kind of forced me. And this is somebody I didn't know. And now here I am saying, yeah, you really need to do this. I think the other thing I want patients here to know, that sometimes the very first treatment is very important to your long-term survival. So there is standard of care, and that will be usually at any hospital, you're going to get this treatment, but sometimes people need a little bit something different. I'm thinking of a woman who is 31 years old, stage 4 breast cancer. Now, she was so freaked out, she didn't want to talk to me, but her husband and I have been talking, and he was ready to go totally alternative. And when I say, I think the term to me, alternative, means not using traditional or outside conventional. And so I said, well, let's just wait a minute and let me do the research on this company and what you're saying you want to do. And so I went into the literature and did a review, and then I went to the site, And I could find no support for this particular therapy. And they were on YouTube. So I asked them, I said, can you provide me with the research for your, and then I went back to him and I said, this sounds really bad to me. All I can say is I wouldn't do it. I wouldn't suggest that you do it. And then eventually he went and got second and third opinions, and they went to a trial. So they went outside standard care to a trial. So it is a very individual thing. Once, to me, you get the medical side of it, then you start looking at what else can support me. I had another woman in her 70s. She said, okay, stage 3 rectal cancer, a little bit different than colon cancer, a little more aggressive. And she said, I want to do both, and I'm going to find a doctor. So I helped her find an integrative oncologist who gave her high vitamin treatments, stuff. She flew through her regime, which was hard. Because I think she paced with the doctor, that her doctor was working with the oncologist. So they were working together. And it really made a difference in how she felt and how she went through. So yeah, to me, this one thing is get your right diagnosis, get your treatment in place, and then start adding all the lifestyle support.
Beautiful. Thank you. So we've heard now from the clinical side, right? We've heard from health coaches. We've heard from patient advocates. There are many people that can help individuals navigate the terrain. And a lot of people think that they can do it on their own. A lot of people have difficulty asking for help. So that role of the support network is extremely important. The role not just of only asking for help, but actually receiving help. So I would like to just come over to Susie Ellis before I open it up to everybody to see if there's anything that you might want to add.
Thank you, Julie. Well, the thing that I want to add at this point is that this has been so valuable to listen to the people you have collected, Julie, and yourself. And I guess when I saw the series, to me, it felt immediately that this is a springboard for a conversation, because as you said, Julie, there's the wellness side and the medical side, and there's been this kind of interaction, and this and more there is more medical now looking at lifestyle and so on. And so what I've learned this morning is that listening is so valuable. And each of those of you who've spoken, I've been trying to listen and not look at the chat, although I want to look at the chat. But what you're saying is so valuable, because what I realize is that you have worked with so many people that have had cancer and looked at lifestyle and medicine. So we can learn so much from you. And so I just find that this is a valuable thing to have this conversation. And I look forward to it. And it's one of the reasons we afterwards send the chat out, because I know what's being said in the chat is really important and valuable. And I can't wait to read it and then focus on what that person is saying. However, just like all of our days, we have so much coming at us. We've got the chat right now and people talking, and it's a lot. But if we can just focus on the present and really listen, there is so much value in listening to each other. So I'm just delighted to see what you're doing here, Julie, and you're really good at curating it and also leading this conversation. So thank you for saying yes to, or, I'm glad that after the series we connected and thought, yes, let's do this.
Thank you. So we're going to piggyback with Terry, who just put in a comment. And Terry is on the Education for Society of Integrative Oncology. And, they are a leading body, really the leading body that helps to define guidelines. So you will see in the slide deck that we will share afterward a definition of SIO, or Integrative Oncology, which really is conventional treatment, plus lifestyle medicine, plus complementary equals integrative oncology. And Terry's a thriver, also a researcher. So Terry, I just wanted to open quickly to you on the Dr. Wayne Jonas top 3 modalities in the gap between patient and oncologist.
Yeah, thank you. Happy to ring in on that. So I am a researcher, I am a survivor, I am a patient advocate, and I've published my own research. So the Wayne Jonas research that I worked with him and his team on highlighted that, first of all, patients are using what I'm going to call collectively integrative therapies. So things like acupuncture, massage, yoga, nutrition, exercise, all of it. There's a list of 12 we use. Patients are using it. Actually, in this study, it was 64% of patients in the US said they were using it. And I think the numbers are sometimes higher, using at least one of those. Doctors only think 40% of patients are using it because we're not telling them. Now, I know there's fear. I know there's doctor judgment. I know there's reasons as a patient why I even didn't want to tell my doctor. I did eventually. But my point is, the doctors don't know. The more they know, the more we make noise about it, the more they're going to say, hey, if I want a satisfied patient, this is important. Hey, we need to get programs. Like some of the programs that were being described earlier are beautiful, but they're not in every cancer center. So the gap, Julie, to get to your point, is we tested 12 complementary and lifestyle therapies that, again, go along with the conventional medicine. So it's both. And the ones that were the biggest gap in terms of what patients want versus what hospitals are currently offering were exercise consultation or programs. And it doesn't have to be vigorous exercise. Any movement is good. A lot of data to support that helps with many aspects, including survival. The second was massage therapy, important to so many aspects of mind and body, and just thinking through the mind-body connection. And the third one was meditation and mindfulness, which to me was the biggest aha in this study. Was patients are already understanding it's important to monitor your mind, to do what you can. Someone brought up stress earlier, to manage stress, to pay attention to your mental health. And meditation and mindfulness are two very easy, can be very low cost and very low time commitment ways to do that. So Julie, along with those, nutrition, mental health support, and spiritual services were the other main ones that patients are saying they're using. But those 3, exercise, massage, and meditation, mindfulness.
Yeah, and I just wanted to add, if we can mute that person, there we go, that there was research in that study too that said that people would choose a cancer center that provided complementary therapies over one that did not, correct?
Yeah, it was interesting. There was 2 pieces of data. I'm looking at the report on my other screen. One was, would you have been more satisfied if you were offered this? And patients by and large said that they would. And then the other one was, I have the data for this. Would you actually have gone back in time and chosen a health system that offered more complementary and lifestyle therapies? If you could have, more than half, 55% of patients said they would have. And I think the point to make also in the bigger picture is patients would have been more satisfied. They would have chosen these centers that offered more. That's the demand that we need to let them know, because systems are measured on patient satisfaction, and these things relate directly to how patients feel and how happy they are at the end of their treatment, how satisfied they are.
Yeah, beautiful. I wanted to come over to Jay Harness that has Cancer Fitness. I think it's Cancer Fitness. It changed somewhere along the way, I think, because exercise as cancer medicine, exercise and nutrition are really gaining a lot of traction. Jay, are you still on?
Yep, I sure am.
Love for you to share a little bit about the role of fitness. And it's not just, strength training. I loved your pickleball post, by the way. So if you could just share a little bit so that people, aren't so like, oh my God, I got to go exercise at the gym 150 minutes, a week.
Yeah, people unfortunately think I'm training for a half marathon or a full marathon or an Ironman. No, we're not talking about that at all. Thanks, Julie. Yeah, what we're talking about is 5 days a week for 30 minutes of moderate aerobic exercise, where hopefully you're getting your heart rate up above 100. We're also talking about 2 to 3 days of some resistance training. It can be done with resistance bands or light weights or whatever. It can be done virtually or at home. As Lainey knows, One of the leading people in the country is Katie Schmitz at her institution at UPMC. One of the things that's really important is that patients be referred to programs. It really takes a village to treat cancer patients in this day and age. And that village consists of the obvious people, the surgeons, the med-oncs, the rad-oncs, the physical therapists, but now all the other integrative components as well. One of the things we do know, Julie, is that brochure therapy doesn't work. Handing a patient a brochure and saying, doing this doesn't work. Referring them to a program where they can bond with people, their trainer or the other people that are there, that's what keeps people going, lowers their anxiety, lowers their fear. As a physician newbie to this world, what I've discovered in the last 5, 6 years is very few of my medical colleagues are aware of the hard science that's been generated over this past 30 years by the PhD researchers in exercise physiology, kinesiology, sports medicine, etc. So part of Jay's role now is to become an information center for my colleagues as well as patients. And so I recently launched, and it's called cancerfitness.org. It's an org, cancerfitness.org. And I also, if people would like to be included on my email list, I now have 330 people on an email list. Julie, you're one of them, that I send out, like I did the article about pickleball for cancer survivors. You can email me at info@cancerfitness.org, and it'd be my pleasure to add your name and email address to that list, okay? But I think for the patients who are on the call with us today, Julie, it takes a village, and that village more and more will be an integrative village. That's one of the key caveats from this morning.
Love that. I'd like to come over to Petra, and then I have all of my surprise guests finished. So Petra is from Outdoors Against Cancer, coming along with the exercise theme. One of the things that I love here in Vail, Colorado is when someone is diagnosed, there's a program called Fit for Survival. They get a lifetime membership to a gym. They go on hikes. They do a lot of things. And I didn't know I lived in a bubble. That was 20 years ago that they started this. So I found a similar type program, very different, that has EU funding. Petra, would you come on and talk a little bit about Outdoor Against Cancer and your other program?
Hello, everybody. Thank you, Julie, for inviting me. Yes, I founded Outdoor Against Cancer during my own chemotherapy. I've got my breast cancer diagnosis in 2015, and I did some research, and I figured out that I can continue with all these physical activity stuff I've done before. I just came back from a expedition in Papua New Guinea. I climbed one of the 7 summits of this world, and I was super fit due to the height, yeah. And so I was asking my oncologist and my medical doctors if it's possible to go ski mountaineering and climbing and all that things. And they said, yes, go ahead, but be careful with your heart. And during, I was ski mountaineering with a friend of mine in March, so shortly after my first chemotherapy, he said, oh, we could do something like this with cancer patients. And so the idea came up to do this Outdoor Against Cancer. And 1 year later, I was invited by the European Commission to a workshop, The Fight Against Cancer as a Team Sport, the Role of Education and Sports. And since then, we are the only organization which developed a training for medical doctors. We're certified with 60 CME points on an international level to advocate and to educate also cancer survivors. We call them all survivors and not patients, because survivor, if you are a survivor, this is a bit more, I would say, positive for everyone who has got the diagnosis. So we go with the definition of cancer survivors. And since then, we wrote several project proposals when it comes to EU funding. And we, in summary, in the last 2 years, we get funded to Speak Open together with some other partners with 12.9 million euros. And we translated all the things we have done. So we have four key pillars: physical activity and outdoor sports, balanced nutrition, physical and mental health, and sustainability in nature. And during this project, we figured out that this physical activity thing outdoors is the key to everything. So I started my training with cancer patients shortly after my mastectomy and my radiotherapy in Munich in December 2015. And now in 3 weeks, we will start a new training program, which is already certified. It's called 4x4 training. It's also outdoors in the public area. So in case you're interested, we will share afterwards also a document, and you can register for that. The thing is that we figured out that all patients who are sent, we are collaborating in Germany, we are collaborating with the comprehensive cancer centers, yeah, and they're sending the patients shortly after the diagnosis, before they get their first treatment, to our groups. And this is fantastic, because the first day they come with a car. The second time they think, oh, perhaps I can take the public transport. And the third time they are coming with a bike. They change their behavior when it comes to their daily routine. So they go out for a short walk in the morning, in the evening, so they sleep better. So this outdoor thing is really mind-blowing and changing, because the biggest problem, we all, and all of you are doing a great work. I think I'm not the person who can say that, but I do it. So
53185.
The thing is that
signature for the chart.
Oh, can you hear me? Someone was talking. Okay. The thing is that we figured out that people who come to our outdoor trainings in the urban areas or in the countryside, they change their behavior, because the biggest problem we are facing is behavior change. You know, we have a lot of patients who we know that there is a recommendation about this 150 minutes. And there is a recommendation to start physical activity.
And the text that belongs with this first one just states you agree to this.
When you get your diagnosis, but what will you do with people who never trained, who never were physically active? So we are focusing also our work on this behavior change, and that works quite well with the community training outdoors, which is recommended by the comprehensive cancer centers in Germany and on a European level. That's it.
Great, thank you. And Christy from Penny Braun would be another great example, as we have some cancer support centers here, and I love what they do. So if you could briefly just share, and then I think we'll have a little bit time for 2 more shares of anyone else that would like to share. You need to unmute.
Amazing. Thank you, Julie. And yeah, just as you were speaking, Petra, I could see, so we've got a retreat going on at Penny Braun at the moment. I could see everyone on a mindful walk around the Penny Braun Gardens. So yeah, really good timing. So yeah, we're a cancer-based cancer wellbeing centre near Bristol in the UK, and we offer nutrition sessions, counselling sessions, movement sessions, one-to-ones with doctors. So it's a place where people are often referred to by the NHS, and they come to us and they receive that support and that whole person approach that maybe they're not able to access in the NHS, because it's, yeah, their capacity is very full. We know they're busy. And so people come to us, and our approach very much is making it available to people who have never done wellness before. This might be the first thing that they're finding. And so we're really passionate about making it making sure that people can really understand what we're saying and what we're offering without it feeling isolating and too much. And so, yeah, we offer a treatment support program, which is a service led by a doctor team and a cancer nurse. And that's the support that goes throughout their treatment. And so, yeah, there's this huge kind of foundation that people come. And yeah, it's incredible to see their journey and how people respond and how people leave and the feedback we get. So yeah, send people our way if you're in the UK, and then also abroad. We offer a lot online, so you can join, many of our sessions abroad.
Yeah, and it's great if you even look at the health literacy and how things are positioned, very simple language, which again is, I think what promotes a lot on the Instagram is the simplicity of language and not the technical jargon that we often hear. Would anybody else like to share anything we just shared, Terry just shared just for you to have the definition of integrative oncology, the things that SIO and BSIO do as far as research in prevention. I know we have some Ayurvedic doctors in here and naturopaths. So you'll see that SIO has what's called special interest groups that you can be with your peers to learn more information, I think is very helpful. So I just wanted to say that as Terry just shared that in there. Anything that has come to mind? Go ahead, Wade. Love that you raised your hand.
Hi, this has been amazing. Thanks so much. I was diagnosed with Hodgkin's lymphoma at 21 years old, and I remember trying to find, it was a very interesting period where, not wanting to be a cancer patient, I think sometimes prevented me from joining any groups and trying to have that social support. And so it really felt like it was a solo journey in healing and trying to get more resourced internally. And so I'm curious if anybody has other resources, because I think the young adult cancer survivorship group is also very underserved. It's typically like very young cancer survivorship, young kids, or, you think about older, but the rate in cancer in young people is growing. So I'm curious if anybody has any data around that or resources.
I think we could do a follow-up with you because we only have a minute, but that was another thing that was highlighted for me in the apple cider vinegar series is the younger, right? And we are seeing an increase in cancer diagnosis earlier.
Julie,
yes.
Because I know we're running close to being, we'd like to finish on time. I'd like to encourage everyone to go into the chat and add whatever resources you might know that would be valuable. And if Jesse, if you'll leave the chat open for a while after we finish so that people can contribute, then I think we'll at least be able to capture some things that you all have that could be valuable. So if we could do that, then that might be a way to get more information that we can share.
Yes, with the new Zoom settings, I think everyone can continue posting on the chat. So please take advantage of that or email me. And then I will make sure that's in the follow-up email. I put my email in the chat.
Great.
And we'll have a resource pack for you. Bina, you've got the last word. You got 30 seconds to a minute.
Thank you so much. I'm actually a physician assistant and I'm also part of SIO. I teach yoga and I just want to share this conversation was so impactful. As I'm doing telehealth, something I'm hearing from a lot of patients is why would we do chemotherapy that's toxic to the body when we're trying to fight this diagnosis? And I feel that this conversation was really focused on self-empowerment and understanding what patients want and what is best for them. What do they know? And so I think this conversation will continue to evolve. And I just want to share it was really impactful for me, both as a clinician, as a teacher, and I'm still learning. So thank you so much.
Beautiful. That was the purpose of this. And please feel free to reach out. We can always have more of these, or this might be its only one. We'll see how it takes life. Thank you so much for making the time, for staying engaged for an hour. Keep posting in the chat. We're going to send out more resources for people as well. Any panelists? We're good? All right.
Thank you, Julie. Thank you, dear panelists. Thank you, everyone, for joining us. There will be a follow-up email sent out later today or tomorrow morning, depending on how many resources we still receive. And thank you, everyone, for joining, and have a great rest of your day. Bye.
Bye. Thank you.
Bye-bye.